Okay, hello, welcome everyone. I'm here, I'm doing a virtual workshop today. I'm going to talk about acute whiplash recovery. For those of you that are on the Instagram feed, you get to look at my face and I'll chit chat. I have a presentation playing here on the computer that will be available later on, so you can go back and review what I've talked about and see some of the slides that I'll be showing to the people who are participating in the virtual workshop from online here. So this workshop I think is the fourth in a series of workshops hosted by Union Physical Therapy. I'm coming to you from the Whiplash Injury Treatment Center in Seattle, Washington. And my screen is not responding. My name is Amanda Benson. I'm a physical therapist here in Seattle, and I've been practicing since 2005. I have a certification in manual physical therapy and a specialty certification in orthopedics. Some of the things that I like to do outside of the clinic, I like to ride my bicycle, I enjoy running, I enjoy spending time with my family, and pre-COVID I enjoyed traveling. I think we'll get back to that at some point. Today the objectives of this workshop, we're going to talk about what a whiplash injury is. I'll talk about some of the symptoms of whiplash. We'll talk about some red flags that may exist. We'll go over some self-screens and things that you can do. Oh, there's somebody tuning in. We'll go over the difference between passive and active treatment. We'll talk about some advice for things that you can do for movement and exercise. We'll go over some posture tips. And then we'll also talk about what the Whiplash Injury Treatment Center, we'll talk a little bit more about that, what it is, and what physical therapy can do for you. So what is a whiplash injury? A whiplash injury is just a forward and back movement of the head and neck. It can cause injury to the tissues around the neck and in the head. It's usually happen when there's a forceful forward and backward motion. It can also be a side-to-side motion. It's common after a car accident, but it can also happen with a fall or any kind of a sports injury. We're talking today about acute whiplash, and I'll define that term. It really is sort of a recent injury. So an acute injury is anything that's less than 2 weeks old. The subacute category is this 2 to 12 week time period. And while during the first 2 weeks of the injury you're dealing with a lot of new inflammation, the subacute period is more with healing of tissue. And typically what we think of as a chronic injury is greater than 3 months or more than that 12-week period. This doesn't mean that some of the things that we talk about today won't be applicable if you were in an auto accident that happened a long time ago, but it just kind of changes the nature of things slightly. When we talk about symptoms of whiplash, neck pain is a major symptom, loss of range of motion, a radiating pain that goes down into your upper back or into your arms. On the other side of this slide, I have other symptoms. So you may experience headache, numbness or tingling, dizziness or fogginess, any visual or hearing changes, or sometimes jaw pain or difficulty swallowing. So those might be some other symptoms that you may experience after having a whiplash injury. So most injuries can be graded to some degree. You'll see on this slide the term WAD, which stands for Whiplash Associated Disorder. The grades go from 0 to 4, 0 being the least severe, where you don't have any signs or symptoms after this movement of your head and neck. The grade 4 is the most severe, which would mean there would be some sort of a break of a bone or a dislocation of a joint. Typically, most of the people who have had a whiplash injury fall into the grade 2 category. And this is neck pain with, so a complaint of neck pain, but also some musculoskeletal sign. And what that musculoskeletal means to a physical therapist is some change in range of motion or a change in way a joint moves or a change in the tone or tension around a muscle. We see grade 3 has that same neck complaint, musculoskeletal signs, and then there's also some sort of neurological sign. And that means maybe the numbness or tingling, maybe some of the dizziness that people might experience. So about 93% of people who have had a whiplash can be classified in this grade 2 category. And then moving on to red flags. So when we talk about red flags in physical therapy or sort of in medicine, these are things that are things that come up that need to be checked out and investigated further. So typically with a whiplash injury, it's not uncommon to have symptoms that come on a little bit later. So you've had this initial injury or kind of event, and then within the hours to days following the incident, your symptoms will sometimes get worse. And that's often because of this increase in inflammation that happens. But if you experience onset of symptoms that's immediate, so you've had this mechanism of injury and you're like, ugh, then that's probably a sign to see your doctor sooner, because that could mean that there's more damage that's been done to tissue. Another red flag would be a complete loss of range of motion. So if somebody comes into my clinic and I ask them to move their head or neck around and all they do is move their eyes, that's a concern for me, and that's something that needs to be checked out. Also a sudden headache, any numbness or tingling into the arms, legs, or face are also need to be checked. There's a list here of the 5 Ds and 3 Ns, which is a way for practitioners to remember kind of these red flags. So double vision or diplopia is one of those. Dizziness, which could be vertigo or lightheadedness. Drop attack, and a drop attack means that you're walking and you fall to the ground without having tripped. Slurred speech or dysarthria, difficulty swallowing or dysphagia. Ataxia, which is a loss of coordination, and that can be in the upper body or the lower body, but it's probably more commonly picked up in the lower body with a difficulty with walking. If you experience nausea, numbness, especially in your face, or nystagmus is an uncontrolled eye movement that is often accompanied by dizziness. If you're experiencing any of these symptoms, then these are things that you need to see your physician about prior to starting any sort of an exercise routine or seeing a physical therapist. So what are some other tools both that we use in the clinic and that you as an audience may be interested in? These are sort of screening tools that you can look towards that may mean that you need to seek additional care. And in this case, I mean that it may be beneficial for you to see a physical therapist. So the first one on here is the visual analog scale. And that's really a pain scale. It takes a 10 centimeter line. On one side it's 0, on the other side it's worst imaginable pain. And you kind of mark your progress through there. If you score higher than a 5 out of 10, consistently score higher than a 5 out of 10, that may mean that you need to see a PT. The other thing on here is the NDI, or the Neck Disability Index, and this is an outcome measure that we commonly use in PT. You can search for a tool online to fill it out. If you just search NDI online calculator, and it'll pull up the outcome measure, and it basically has a list of functional things that some people who have neck pain, it's not specific to whiplash, but people who have neck pain may have a difficult time doing. If you're scoring, I've seen anywhere from 15 to 17 out of 50 or greater on this test, then that may indicate that you have a higher level of disability and you might benefit from seeing a PT. So those are a couple of kind of, I want to say self-screening tools, but really tools that we use daily in the clinic. So what are the best practices for whiplash treatment? Really, studies indicate that active and passive therapies can be helpful, but I'll emphasize the active therapies. Early activation and then a return to your regular activity. And we'll talk through each of those next. So passive treatment is treatment that is done to you. So this is things like massage therapy, acupuncture, maybe manual therapy from your physical therapist, or chiropractic care. And active treatment is treatment that you take an active role in. So these are things like exercises, working on your range of motion, working on balance, working on strengthening exercises. Motor control is a big one here. This is one where you're working on the control of movement that you have in your body. And then also vision therapy are all examples of active treatment. So early activation is just one of the things. So along with completing active treatment, early activation is important. And I think when people kind of historically, whiplash injury was treated by going to your doctor saying, my neck hurts, and your doctor handing you a soft collar, and you put that around your neck, and you walk away and you don't do great, really. And a lot of the studies are showing now that starting to move your neck earlier and not wear the soft collar is really helpful. If we recall back to the slide that talked about the different grades of whiplash injury, there are instances where using some sort of a brace or a collar is important, and those are usually down at that lower level, that grade 4 injury that includes fracture or subluxation. But we've really found that treating the majority of cases with early activation is helpful. There's a statistic that says 50% of the people will recover in the first 3 months following a whiplash injury. So it can be really important to get moving early. And also I found when I was researching this that those who see a physical therapist within the first 28 days after their injury usually have a lower utilization of healthcare overall, which I think is a good thing. So then we'll talk a little bit about what this early activation means. It can be walking. So just getting out and getting some movement. Walking can have a lot of benefits. It creates a little bit of motion through your whole spine and through your body that translates up to your head. It can help with, it increases your heart rate slightly, so you'll get a change in your blood flow. It can help with healing, helps increase your breathing. So all of these can be helpful for promoting healing. And then the other best advice is to just act as usual, kind of return to your regular activities. I think it's important to say that, listen to your body with this. If you're someone, the picture here shows someone gardening. If you've done gardening in the past and you've been working on that and all of a sudden you're in this auto accident, it's okay to get back to gardening, but you might not start with your heavy lifting project. But listen to your body, and you may need to ramp back into some of your activities. But this is really the best advice, is to kind of get back to what you were doing before. So when we talk about exercises, these are 3 good ones to start with. I'll demonstrate some of these. There's some pictures on here, so if you're following from Instagram, these can also be found on our website at www.unionpt.com. But really, so the first one here is just range of motion. And this is working on pain-free range of motion. So sitting up in a tall posture, turning your head side to side, doing some up and down. But just noticing kind of what your range of motion feels like. There may be a limitation when you go to one side. You don't have to push into that limitation. Just notice it and come back and work through your comfortable range of motion. So you can try 5 or 10 repetitions in each direction. This one's a good one to do many times during the day. I put down 3+ times. It might be a good thing to time around your meals. The second exercise on here is a chin tuck exercise, and this starts to focus on the deep neck flexors. These are really important. There have been some studies that show that after an auto accident that there's kind of a change in the timing of how the muscles work, and that you get more activation of the muscles that are superficial or in the front of your neck versus these deep kind of core stabilization muscles. So the chin tuck targets the longus colli and the longus capitis muscle. So when you lie on your back, I like to have people lie with their knees bent. You want a towel roll to go behind your neck and kind of take up the space. It shouldn't push your head up. Your head also shouldn't be tilted back. So you may need a pillow or another kind of folded towel underneath your head. With this exercise, you want to imagine an axis of rotation through your ears, and you're doing a little nod. So it's just chin down, towards the middle of your throat. In the picture on in the slide presentation here, I have my hands kind of resting on my stomach, but you really should have a hand or both hands across the front of your neck to just kind of feel for these muscles that are in the front to make sure they're staying relaxed as you go through this exercise. So it's down into a tuck. Hold for 3 to 5 seconds, 10 repetitions. This is another good one to do 2 or 3 times a day. It's really starting to retrain muscles. And then the final one on here is a scap squeeze or a shoulder blade squeeze. And this one you can do seated or lying down. The seated version is a little bit easier, maybe a good place to start if you're just starting to work in some motion. The one where you're lying down on your stomach, you'll be squeezing shoulder blades against gravity, so it's a little bit more challenging. But it's basically pulling shoulder blades back towards your spine, making sure you keep your muscles relaxed. If you choose the version where you're lying down, it's helpful to make a towel roll to rest your forehead on. And then you may be more comfortable with a pillow underneath your hips to keep your back neutral. And in that position, same thing, just a squeeze of shoulder blades. Your arms might lift up slightly, but you're not looking for a lot of shoulder extension. It's more of just that shoulder blade motion. None of these should create pain. So if you start into these exercises and you're working on them and you're like, feels like it's making things worse, that shouldn't be the case with these. So if you're noticing that, that might be another good indicator that you need to have your specific stuff assessed. So let's talk about posture. In the clinic, I tell people that posture starts at your pelvis, and that means really kind of if you rock your pelvis forward and back, get a sense of what that does to your spine as you move. And you want to find a position where you feel like your pelvis is kind of flat on top and you can sort of stack your body above. The other thing I talk to people about in the clinic is posture vacation. So it may feel, okay, this feels pretty good. I can sit in this position. And then after a little while, you start to slump forward and you get into your work and you realize that your posture is back to what 99% of us look like all day. So just take a little posture vacation, come back up to that starting point and sort of reset. And then finally, taking frequent breaks is important. It may be helpful to set a little timer to remind you to change positions, get back to neutral posture. Maybe every 30 minutes or so, it's probably a good time frame. But it really will vary depending on what you're comfortable with as far as sitting or standing is concerned. There's some comments on workstation ergonomics here, but we also have some of that information on our website with a video. So things to think about are the height of the screen. You should really be at about eye height. If you're using a laptop, that's going to mean that you're going to need a separate mouse and keyboard so that your arms can be in a good resting position. I commented on here that this can be sort of task specific, so I don't know if anyone writes anymore, but if you do, you may need to think about the height of the station where you're writing and the space that you have for that. And also a consideration is a sitting versus a standing workstation. So some people feel more comfortable standing, some people feel more comfortable sitting, some people feel more comfortable kind of changing between those two postures. And that's really my recommendation is if one of those feels better, kind of gravitate towards that, but it may be important to take breaks and switch up your posture. So let's talk a little bit about why, I think going beyond some of these recommendations and why seeking out physical therapy might be important for you. As physical therapists, we're trained to do an individual assessment. So we're going to ask what your symptoms are and what you're coming in with. Everybody's body is a little bit different and everybody has kind of a different medical history or a different, let's call it, body history. We don't plan to be in a motor vehicle accident or have a whiplash injury, so I think what you bring into that instance is important to talk about and make sure that your assessment is individualized. We can provide targeted treatment, so if we find that there's a restriction of motion at a specific joint, we can address that specific joint and that can help you improve faster. And then also I think it's important to talk about each person's specific goals. As a physical therapist, we'll have some goals that we would like you to accomplish during physical therapy, and goals around range of motion and strength and things like that. But you have goals that you bring to the table as well. So maybe you want to get back to your gardening, or back to walking, or back to CrossFit, or back to whatever it is that you enjoy doing. So I think coming up with a treatment plan that addresses what your goals are is an important part of PT. So, a little bit more about the Whiplash Injury Treatment Center. This is a concept that, I was studying for my OCS exam, and I remember looking at some of the research around whiplash injury and thinking, wow, 50% of people get better in 3 months, but I'm seeing people in the clinic that have been many months out, and that kind of coming up with a plan to get people into the clinic sooner, and to kind of educate the public about what PT can do for someone in a kind of an acute phase following whiplash injury. And so I was talking with Mitch Owens, who's one of the practice owners here at Union PT, and he said, I've been thinking about this for a long time, and I think we should design a center where people can come and they can have access to kind of our experience as PTs of being in the field for a long time. We have advanced training in manual therapy, concussion management, vestibular care, TMJ or TMD treatment, and those can all be components to people who maybe have experienced kind of chronic conditions, or can experience continued difficulty after an accident. And then we also have an extensive care network. So these are other practitioners who work to help manage these conditions as well, that we've had a long-standing sort of relationship with, that allows for more of a holistic management of your care. So those are some of the reasons that I think that both physical therapy in general is a good idea to seek after having an auto accident, but also to come and get care at the Whiplash Injury Treatment Center at Union PT. So with that, I've got a list of references here that were kind of listed on the presentation. And then I'm open to any questions. So if anyone has questions about the presentation today, let me know. And thanks for joining me.